Hello, everyone, and welcome to the Medical Fitness Podcast. I'm Jeff Young, and in this episode, I'll be speaking with my co host, Dr. Thomas Hammett. Podcast is brought to you by the Medicine, Rehab, and Fitness Institute and JY Kinesiology LLC, both of which are dedicated to medical fitness education and building the bridge between medicine, rehab, and fitness. You can learn more at mrfinstitute.org. Purpose of our podcast is to provide you with principle and evidence-based content on all things related to exercise science, strength and conditioning, medical fitness, and building the bridge between medicine, rehab, and fitness. In this episode, Thomas and I discuss a best practice approach on how to begin a resistance training program and how this applies to both physical therapy and fitness worlds. We also discuss how the initial familiarization phase differs from the rest of a properly designed resistance training program and why it's a critical start point from a fitness, medical, and even a behavior context. This is a unique opportunity to listen to a seasoned clinician and a seasoned exercise specialist discuss resistance training programming, a topic that many clinicians and fitness professionals are interested in knowing more about and becoming more comfortable with. Let's get started. Hope you enjoy the conversation. All right. Hey, everyone. Welcome to the next episode of the Medical Fitness Podcast. And again, I am here with my co host, Dr. Thomas Hammett, and we're going to be talking a little bit about programming today. We're not going to be able to cover everything, but generally speaking, it'll be programming. So, like last episode, there is no guest. It is going to be me and Thomas talking. So, let me start with welcome to our podcast, Dr. Thomas Hammett.
Yeah, thanks. And if you can believe it, the physical therapist is the one that came up with this programming topic, by the way. So I want to take credit for that before
That's
before
right.
people think PTs can't think about this stuff and talk about this stuff. So I'm excited to have this conversation with you. You're obviously the expert in this situation, but I'm looking forward to having the conversation about this, Jeff.
Yeah, and when I saw when you emailed me the topic, I was just like, well, I know you, so I wasn't surprised, but I was just like, oh, this is great. I'm glad that he wants to talk about this, and this is great for the listeners and viewers to hear this from two perspectives. Even though you're going to be the ones asking me the questions, and I just love the fact that what our podcast brings that's different is your clinical perspective as well. So yeah, I'm ready to dive into it.
Yeah. Well, and I think this topic is a really good one in terms of the overlap between the rehabilitation world and the fitness world. I think thinking about how people start a resistance training program or start their exercise programming in general lives in both worlds. So it is relevant to both of us. It's relevant to both of our professions, and yeah, hopefully meaningful to the listeners. So,
Yeah, absolutely.
all right,
So
should we
I'm
jump
I'm
right in?
I'm ready for you, Thomas. You can fire
Yeah.
away.
All
Just
right,
don't hit me with
perfect.
anything
So
too hard.
yeah, as we've alluded to, this conversation is about programming, and in particular, how people get started with their exercise program. In terms of the terminology that we use, that initial phase is called the familiarization phase. And Jeff, if you wouldn't mind, could you just start off with like a quick definition of what is the familiarization phase of training?
Yep. So the familiarization phase is also known as the initial program design. When I talk about the design, and we're talking about resistance training here. Okay. So from a resistance training standpoint, when I break down how to do programming, I break it down into two categories. There's the initial program design, which is also known as the familiarization phase. And that is also the learning curve phase. And it's a learning curve phase from both the coach's standpoint and the client standpoint. So, as part of my answer to your question, I want to say that one of my pet peeves with, generally speaking, the culture of the fitness industry is that it's too often that it occurs that fitness trainers will just immediately start, given like a normal semi-hard or even hard training session before they even became familiar with the client, and the client became familiar with the philosophy and the program and all the variables, etc. And it scares many times people like you, clinicians, and it's part of the reason why there's a disconnect between medicine and fitness. So the familiarization phase is a common sense, easier way into the program. Allow at least a few sessions for the coach to become familiar with the client and all the things related to that, the client to become familiar with the program itself. And so that's my quick definition of what the familiarization phase is.
Yeah, well, that's great. So I think what I loved about what you just said there is that it's a learning curve phase, and not just a learning curve phase for the client, but it's also the chance for the fitness professional, or for that matter, a physical therapist, if they're the one doing this, to learn enough about their client to program effectively, right? So it's kind of this learning curve for both sides. Um, I think you did a good job there, kind of explaining why a familiarization phase is important, and it is because of that learning curve. Are there any other purposes that you'd outline in terms of what that serves, or maybe even just like give us an idea of how that looks different from the following phases of a resistance training program?
Yeah. So what I'm going to do is I'm going to cheat a little bit here, and since we're on Zoom doing this podcast, I'm going to pull up a share screen share. So for those who are not watching this on YouTube, please just be aware that I just pulled up a share screen. And if you want to, at some point, go over to our YouTube channel, which is at the Medical Fitness Podcast. So you just type that, the at sign, and then the Medical Fitness Podcast is one word in the YouTube search box. And then you can see the visual that we're putting up. So you asked me about the purpose. And how it looks different. And so with this little table that I have, as you can see on the right side, I have the word purpose, and I'm going to click it. And so the purpose is, and it actually even partially answers your previous question about, or you mentioned that I kind of covered why it's important, but this is an additional reason why the familiarization phase is important, and that is that it closely mirrors traditional outpatient orthopedic physical therapy. And that's another reason why it's really important, for reasons we'll get into later in the conversation. But as you can see from the bullet points, the primary purpose of this phase, again, it's a learning curve phase. So the coach needs to learn and determine the client's available pain-free range of motion, because so many people are walking around with joint pain, or they may have been referred through a physical therapist, and they're still dealing with some joint issues or conditions, or even stuff that is asymptomatic. So there might be a condition that's asymptomatic, that you still want to determine the proper range of motion for that person so that you don't flare anything up. So in any case, the purpose of this phase is to determine available pain-free range of motion, the appropriate exercises, and that may have to do somewhat with the setting that you're in, whether it's a home exercise program or a gym setting. But the bottom line is you need to determine the appropriate exercises for that person, and not just assume they can do everything, which is just, again, so common in the health club world. You just throw exercises at people without actually critically thinking about it. Um, you use this phase to learn, from a coach's standpoint, to teach the names of exercises and teach proper form. And you can't teach proper form in one session on everything. So that's part of the reason why it's a phase. You have to do this over the course of a phase. Um, we're going to use what's called a rate of perceived effort. And I'm just going to call them effort scale. So how much effort are you putting into the set? So there's a way to determine effort, using what's called RPE scales. And we're going to use these scales as a way to not only determine what weights they're going to start with for each exercise, but then how we're going to progress their weights, not only through this phase, but then ongoing. So that's another purpose for this phase. There's going to be a ton of cueing. So we're going to use verbal cues, visual cues like the mirror or videotaping, and then showing them a slow motion afterwards or something like that. And what's called tactile cues, which is PTs are really familiar with this, but a lot of trainers aren't. I actually wasn't until I started working alongside PTs. Tactile cues, what are you even talking about? But when appropriate, we want to touch them to help establish mind muscle connections. And then another really important thing that a lot of people don't think about is, especially those who have chronic disease and or musculoskeletal issues. In so many cases, they're apprehensive, they're scared, and they're scared of getting hurt. They're scared of progressing. They're scared of quote unquote lifting weights. So this is just a nice way to ease them in and get them to not only develop trust in the resistance training and sessions, the program itself, but for using me as an example, me as the coach, and for them to realize that no, I'm not going to kill you. I'm actually going to find your comfort zone and meet you where you're at. It's a meet you where you're at phase.
Yeah. So this phase is critical, right? You're talking about in this pretty short period of time, we're doing some level of assessment, we're getting to know the client, we're providing education. And then that develop trust and resistance training really is we're supporting behavior change, right? Like all of these things are supporting a behavior change towards starting this program. And when I think about in particular in a medical context with physical therapy, a lot. So, I mean, there's a couple of purposes that we prescribe exercise and PT. The primary one that everyone would think about is, addressing a physical dysfunction like pain or reduced range of motion or just general functional deficits. But there's also this secondary, and I would even sometimes call primary purpose of prescribing exercise that's let's get you to get used to moving your body again and build that habit around movement and strength training for that matter. If we get to that, that type of exercise in physical therapy, which I think our profession is moving towards. So this, yeah, as you're describing, Jeff, this phase is critical, not just because we need to get to know the person, not just because we need to do assessment, but because that whole process is supporting and building towards something that comes next and hopefully sustains for a long time.
Yeah, let me actually interject and say that two things. One, it is absolutely critical. And so therefore it's actually a pet it's rare. So it's become a little bit of a pet peeve of mine because this should just be it's critical, therefore it should be way more common and not uncommon, and this should really be the start point. So that's one thing I want to say related to what you just said, and the other is behavior change and how it helps facilitate that. And you're so on the money, and it actually makes me realize that I should probably make this table a little bit bigger and add one more bullet point, because this you actually hit on something that's really, really important that I kind of alluded to as part of my answer when I said that people are scared, they're apprehensive, right? And so this is a way to help facilitate that behavior change. So for those who are familiar with the trans theoretical model and the pre-contemplation, contemplation, etc., obviously by the time they get here, they're not pre-contemplating or contemplating anymore. But they're still apprehensive. Part of a way to decrease that apprehension and facilitate change of behavior is self-efficacy, right? And giving them confidence. And so that's
Mhm.
another major purpose of this phase that actually needs to, well, I guess I'm alluding to it in the last bullet point when I say develop trust in the program, but develop trust through building confidence and having them experiencing success by not giving them something that's too hard. And then obviously the social skills of the trainer is really important here too, and to to praise them when they do things right, praise them for proper form, praise them for in week 2 that they progressed 2 pounds, 5 pounds, 10 pounds in an exercise or something like that, and use that as part of this phase as well. So I'm so glad that you mentioned behavior change, because it is another reason why this phase is critical and needs to be common and not uncommon.
Sure. I think your response there is a really good segue to the next question that I want to ask you, because I think for any fitness professional or, any professional that's thinking about, man, I really need to start doing this, but it feels overwhelming. There's a lot that needs to go into
Yes.
this phase in a short period of time. What's the right order? How do I do it the right way? I think a lot of people would be sitting there thinking, how do I get started? Like what's the first step? And for you, Jeff, I mean, whether you want to talk through just the first thing that you educate or maybe go through your process, but what is your process? How do you get started? And what's the first thing that you educate your clients on when starting a program?
Yeah, so let me start with an answer to that question, and I'm actually going to pull up the information I have on the left side of this table, um, which kind of relates to this, and it kind of relates to the last question too. So, but I'll start with that as a way to answer your question. So, part of the reason why this is important and part of the purpose it serves is can be explained with the setup and the fact that again the familiarization phase very closely mirrors traditional orthopedic physical therapy. So what I mean by that is that it's really common in the physical therapy world when PTs are prescribing exercise during the visits for PTs to prescribe 2 or 3 sets of 10. Very common. And so this is also where you want to start with in the familiarization phase. And part of the reason why this is important is because if it's a situation where the client that you now have has been referred through a physical therapist, or even if that's not the case and they've had physical therapy maybe recently in the last 6 months, or they just have had it before. So it helps with the familiarization because it's a language they speak. 2 to 3 sets of 10. I know what this, this is, I'm used to this. So they're already starting with something that they're familiar with. And it also makes it easy for the coach because that's easy. 2 to 3 sets of 10 for each muscle group. From an intensity standpoint, you can see there in the table, it says begin at a 5 RPE. It might be outside the scope to get into this too much detail, but basically what that means is on a 1 to 10 scale, a 5, which is right in the middle of it, means that the effort they put into the set felt moderate. So at the end of the set, you don't want it to feel hard. You want it to feel moderate. So in other words, you want to actually choose weights that are like a warm-up intensity, not too light, but still in that warm up range, especially in week one, to kind of again to ease them into the program. And then a primary difference between um, this familiarization phase and PTs is that we're doing a total body workout, whereas with a PT they're obviously limited to certain areas of the body. So that's part of the answer to your question. And but you also asked me, why is it important? What purpose does it serve? Again, the main purpose that it serves is if the person has been referred through physical therapy, it is a common sense way to transition them because it starts with something they're familiar with. Um, and if they haven't been referred through physical therapy, or if they haven't had physical therapy in a while, and they're just kind of going from their general activities of daily living, and they've never been on a resistance training program, it's still common sense. Because the truth is, like for example, you and I are all about this medicine, rehab, fitness continuum and pathway, and moving patients through. And perfect world, ideal situation, every patient would be moved from family medicine or from their some sort of physician to physical therapy first and then to fitness. So if it happened to be a case where they weren't moved to physical therapy first, well, guess what? Now they're actually this kind of hopefully I'm making sense. This kind of mirrors that. And it's starting with a physical therapy like pit stop before you then hit them on the outside of the learning curve and onto a more progressive program.
Yeah, I'm glad that you brought in, Jeff, the idea of that pathway. And as I'm hearing you talk, I think it's relevant to talk about how how a physical therapist can set up and really be a good member of this pathway. And there's a couple things just looking at this table, whether it's 2 to 3 sets of 10, I don't think we need to stress that too much, but knowing that the intensity is something that we can teach, right? That we can start teaching our patients in physical therapy RPE. And by the time they come to a fitness professional, it's maybe not the first time they've ever heard it. Maybe there's different things that you'll look at. You may be a little bit more focused on breathing rate and heart rate than a PT might be. Though, again, I would love to see that, that a PT and starts to incorporate all that stuff. And then the total body workout is the part, as you said, Jeff, that typically is different. PTs often are focused on a single body segment. And, if you're treating as a physical therapist in an insurance-based model, sometimes we're constrained to how is it relevant to a patient's impairment. Now, what I'll say is, I think there's a lot of ways to justify full body movement, or at least multi-joint movement, as part of the physical therapy plan. And what we can do to really prepare people to move on to a fitness world is don't just give single joint exercises that are directly for the thing that you're quote unquote treating or addressing in PT. If someone has a shoulder issue, teach them how to move their entire upper extremity. If someone has a lower extremity or a lumbar issue, teach them how to move their entire lower extremity and do exercises that move that entire lower extremity. Those are the things that we can do to prepare people for moving to the next phase and to make it feel more relevant when someone's starting down the road with fitness. And I think that's a really important thing for us to be able to do in our phase of that continuum, Jeff. So I appreciate you throwing in there that this can be a continuum. There's ways that we can be good partners in that.
Yeah, and I'll just quickly add that it's just another reason why I'm so glad that we're doing this podcast, why I think it's important because you and I bring um in so many ways a different perspective that people just need to hear and that I just think that a lot of people aren't thinking about. And so this is just an example of how we need to communicate. The fitness professionals, physical therapists, the clinicians, the medical world, we need to communicate. And then, the reason why I even do this, I didn't start doing this in the beginning of my career, and I didn't learn this in an exercise science program. I learned this because of working alongside of clinicians and working alongside of physiatrist and physical therapist and over the course of time with all the candid conversations, the in-service staff developments that I went to, light bulbs going off in my head over time. And so this is something that evolved and developed because of conversations with clinicians. So again, it just pains me that we're so disconnected from each other because when we connect, then light bulbs go off and you can start having ideas like this that are common sense and everybody benefits, ultimately the patient and or the client. So yeah,
Sure.
that's my response to what you just said.
Sure, sure. Well, and I think you and I get on this conversation often, and maybe we should digress back to the particular familiarization phase, because you and I could talk about this bridge conversation for forever, right?
Yeah.
But I think there's a couple elements of the familiarization phase that I don't want to lose that I think are important right now for us, right? Which is like, so we've got this set up, and we've got, I think, a good idea of what the familiarization phase is. Um, how do you know it's done? Like when do you, Jeff Young, decide that a client is ready to move on from the familiarization phase? And maybe, whether that's goals that you set or there's a timeline. Can you share a little bit more about what that looks like?
By the way, most people looking for the services of a fitness professional are really just looking for information on how to get started on the right path, not to pay for training sessions every week for months or years on end. For the 60 to 70% of people with chronic disease and or joint pain, they're also looking for someone who can help them develop a clinically safe, individualized exercise program that takes their conditions into consideration. If you're interested in getting yourself or for clinicians, your patients started on a safe, cost-friendly medical fitness program, you can find more information about the virtual services we offer at mrfinstitute.org/services. We staff only degreed kinesiologists and exercise physiologists and will work with your healthcare providers in the design of your exercise program. For the clinicians listening in, you can add this virtual service as a reduced cost option for your patients. Check out our website and send us an email, and we'll give you the details about this unique and much needed service. Yeah, absolutely. And I'm going to click this again and bring up the information in the very bottom of this table. As you can see, it's only 3 bullet points. And it says the end of this stage is determined by, and it's 3 things. So again, this is the learning curve phase. It's the training wheels are still on. And at some point we need to take the training wheels off. And it typically only takes about, for most people, there's always going to be outliers, but for most people, this phase really only has to last 3 or 4 weeks. And the way you determine the end of it is that number one, they're showing proficiency in movement. So in other words, they understand proper form for the um, exercises that you're including in the program. And actually, let me go back up to that left side where I have frequency, repetition, sets, intensity, and say that another thing that maybe I should make this table a little bit bigger and include is variety, because you want the familiarization phase to be purposely low in volume, which is the reason why it's only 2 to 3 sets, low in intensity, which is the reason why you want to start off with warm up intensity weights that you're choosing, and really low in variety. You can add the variety later on when you're progressing the program, but you want to just keep things simple and just sit to stand, as your main lower body exercise, or maybe a leg press along with it or something like that. One or two chest exercises, one or two back exercises. So you want the variety to be low too. So when when the client is showing that they understand proper form for the exercises that you included in the program, when the intensity of the sets have moved from a warm up to a true working set, which I'll describe here in a second what I mean by that. And when you've moved, like for instance, maybe in week one, you started with just 2 sets of 10 for your exercises. It doesn't have to be the start point from a volume standpoint. But if you, for example, if you started with 2 sets of 10, you really should within this phase move them to 3 sets. So when the volumes hit 3 sets, the intensity is now a true working set and they understand proper form. That's it. Phase is over. And it really only takes 3 to 4 weeks in most cases to go through that. So let me also, and I don't have a visual for what I'm getting ready to say, um, but it's how I'll wrap up answering this question. For example, and let's say, Thomas, you're my client. Week one, I'm going to do a total body, which means that we're going to do an exercise for legs, or at least maybe a couple exercises for legs, back, chest, shoulders. We might throw some calves and hips in there or whatever. It's going to be 10 repetitions per set. And in week one, we might start with just 2 sets at a 5 RPE, so warm up intensity. Week two, I'm still going to keep you at 10 repetitions per set through this entire 3 or 4 week phase. So that won't change. But what will change is I'm going to start to increase the load a little bit. So I'm going to ask you whenever you come in, I'm going to say, hey, Thomas, how do you feel? How did your body respond to the last session? And because we're just using warm up intensity and low volume, you're very likely going to say, yeah, well, I wasn't sore at all. Everything's great. I feel good. And that's going to let me know, okay, so now here we are in week two, and I'm going to up the loads a little bit, not much, but just enough so that now the rate of perceived effort is a 6. It's still a warm up, but because of those loads increasing, the weight increasing at 10 repetitions per set, we're taking you a little bit closer to muscle failure, and it's feeling just a little bit harder. We'll keep you there for 1 or maybe 2 weeks at a 6 RPE, and I'll continue to ask you, for example, let's say you're coming in 2 times a week. I'll continue to ask you, Thomas, how are you feeling? How's your body respond to the sessions? And again, since it's still warm up intensity, you are likely going to say, yeah, my muscle, I feel a little soreness, but it's like that good soreness. I can feel that my muscles did something. But yeah, I feel good and there's no joint pain. As a matter of fact, I'm feeling better. My joints are feeling better. And then that's when the last week of the phase, you increase the loads again. That could be week 3, it could be week 4, but you increase the loads one more time it's still at 10 repetitions per set. Now you're taking them a little closer to muscle failure. And now this is a true working set where you can tell that the effort that they're putting in the set is a little bit harder. They're getting that little look of strain on their face, and things like that. And so when they get to that point, that's it. Hopefully, we'll never be in this phase again, ever, because now we're going to put them on a progressive program, which really should be a lifelong program.
That's so great, Jeff. I want, and I'm upset that we didn't talk about the variety, the low variety, when we were talking about that, kind of the general setup of the program. This is another thing on the PT side of, if you've ever been to physical therapy before and engaged in a long-term plan of care, and every time you go in to see your PT, you're walking out of there with a different piece of paper or a different prescription on an app that is new exercises. And, we're guilty of it at every level of exercise prescription, that early on, what we do to engage people. And yeah, I would say sometimes it's effective at engaging people, but it's definitely not best practice. What we do is increase the variety of exercise. In Pinnacle, we call it exertainment. And it's really just providing new exercises for the purpose of entertaining people, or for entertaining ourselves for that matter, right? And early on, it is not the most effective way to program. It may be an effective way to entertain people, but if you want the purpose of all the things that you just said, Jeff, of, getting people to a place where, okay, now we're ready to move on to the next phase of training, it's not providing a bunch of new stimuli in terms of variety, right? So I'm really glad you mentioned that. That is a problem inherent in at, like I said, at multiple phases of exercise prescription. So really glad that you mentioned it. And what you started to do towards the end of your, kind of your last segment was talking about how this phase then transitions into the next phase of training. And for you, and speak for yourself or at whatever level you're comfortable speaking to, but what for you is different about the familiarization phase than the phases that follow? So how does it look different when you move on to the next phase after this first, ideally 3 to 4 weeks, or after those goals that you mentioned have been met?
Yeah, so I'm going to jump to the next slide as my way to answer this question with as you can see from a table that is titled linear periodization. So another thing that just, is just a pet peeve of mine. Um, like it's almost like a lot of what goes on in the health club world is almost like the antithesis of what we learn in exercise science programs. And but with that said, exercise science or kinesiology programs also hold some of the guilt, because when we learn in class about this concept called periodization, we typically always learn it in the sense that it applies just to athletes. It's an athlete thing, and it's a way to prepare them for their competition. The truth is that while that's true for athletes, the concepts also apply to the general population. And when in my opinion, we as fitness professionals should become familiar with governing body guidelines. And generally speaking, the governing body guidelines, and more specifically the American College of Sports Medicine and National Strength and Conditioning Association, suggest that pretty much for general strength fitness, say, so in other words, not a competitive like strongman or an athlete or something like that, but for just strength fitness from a general standpoint, that across the pretty much the entire lifespan from teens into your say 90s and everywhere in between, that people should train across that 6 to 15 repetition spectrum. So as you look at this table, what it's actually describing is a very common sense way to move through this 6 to 15 repetition spectrum, which again follows governing body guidelines. So the way the familiarization phase differs from progression is basically you start, as you can see from the table, by moving from that 10 repetitions per set to 12 to 15 repetitions per set, the high end of that 6 to 15 repetition spectrum. And you stay there for about a 3 to 4 week phase. And you can have a bunch of goals within that phase. If you look at the bullet points down at the bottom, some of those goals may be to increase variety, like you just talked about. Maybe we do start to add another exercise or two to the muscle groups. Maybe we also want to start to increase, at least in some of the sessions, how close that person goes to muscle failure. But the main thing that you don't want to lose sight of as a coach is that last column there, which says that you want to increase strength by the end of the phase. So in other words, again, Thomas, you're my client. In week one, we just got out of the familiarization phase. We're now starting in that 12 to 15 repetitions per set. And in week one, my job is to find the weights that, feel like about a 7 on a scale of 1 to 10, at about 12 repetitions per set. But for every exercise, that is. By the end of that phase, week 3 or week 4, I need to make sure that your strength increased within that repetition. You can't lose sight of that. So that you're a little bit stronger at the end of the phase than you were in the beginning. And this actually shouldn't be something we have to think a whole lot about. It should just be a natural product of the fact that your sets are true working sets. So you're just going to notice, for example, to give this more clarity, that if I don't increase the weights, wait a second, we're in week 3 now, and these same weights are feeling too easy. So you're going to notice that, and the coach should actually have the experience to know that, yeah, in order for me to keep this about a 7 or an 8 RPE, I need to increase the load. So you'll naturally get stronger. And what that does is it not only prepares the body for when you move down to 10 to 12 repetitions per set, it prepares the mind as well. It's critical for people to understand that, your body and your mind. And so then as you can see from the table, you move down to 10 to 12 repetitions per set, and you basically just rinse and repeat. You stay there for a 3 to 4 week phase. You can have multiple goals within the phase, increase variety, um, You start to make sure that within the scope of the week, some of your sessions are harder and some of them are lighter. You don't want to always go hard, 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 but you also don't always want to go light, light, light. So you want to vary intensities within the scope of the week, but you just make sure that by the end of the phase, you're a little stronger at 10 to 12 repetitions per set than you were in week one. And again, that's a natural product of sets being true working sets. That then prepares your body, your mind and your body to move 2 repetitions down to 8 to 10 repetitions per set. You do the exact same thing, and then finally 6 to 8 repetitions per set, um, to end that little 4 phase cycle that now just cycled you through that 6 to 15 repetition spectrum in a linear, common sense fashion. And if I click this one more time, you'll see at the bottom it says this is lifelong. So many people program hop. They go on a program and then it has some sort of time frame on it, some 30-day challenge or whatever. And what do I do now? Well, what do you do after you're finished these 4 phases? You start over again. And maybe you take like a week off, what's called active rest, where you kind of recover for a short period of time to recover and recuperate from those 4 phases that you went through, but then you cycle through it again. And you'll notice that the next time you're around, you're a little stronger and you're a little more fit and your joints feel a little bit better than you were um, the first time around. And you can keep doing it this way lifelong. You can switch to what's called a nonlinear model, which is absolutely outside of the scope of today's topic. But the point is that periodization, whether it's linear or nonlinear, is a lifelong mode of training.
Yeah. So this familiarization phase then really is a strategic introduction.
Exactly right.
And you can see that once the phase of familiarization ends, the purpose goes from we're strategically introducing a lot of new things and getting your body used to that set of movements to, all right, now you're used to it. It's time to get stronger. And every phase that follows is now we're doing this for the purpose of increasing strength. And obviously there's tons of purposes of doing resistance training, but the primary outcome that we're going to look for is, yeah, are we getting a little bit stronger at the end of each phase? So that's a big shift from the beginning to when we get into this program. And I think an important distinction, that first phase, we're not trying to get people way stronger in the first 3 to 4 weeks. It's a strategic introduction with a set of variables that are important, and goals to achieve, right?
And you nailed it again, like when you said about strength progression. And we're on the NSCA special populations special interest group, and a huge purpose for the formation of this group and the message that we're trying to get out is that we need to safely progress people in strength, whether they're quote unquote apparently healthy and they don't have any known chronic disease or joint pain, musculoskeletal issues, or if they do. We can't be afraid of progression. So that's another reason why this is should just it's just common sense. It's just a common sense way to progress in strength, because when you're first starting these 4 cycles, you're starting with lighter weights at the 12 to 15 repetition range, where there's actually not going to be a whole lot of increases in strength. There will be some, but you're actually working a little bit more on what's called local muscle endurance. But as you move through these phases, you're increasing the loads in a systematic fashion, and therefore you are progressing naturally in strength, which is so important for tissue health, tissue resiliency, keeping yourself from getting re-injured, just health in general. And also, again, that behavior change as well, because people are just going to notice, I didn't know I could lift, this type of weight. I didn't realize I was capable of that. So they get
Mhm.
excited. Actually, I'm going to click one more time to one more table here, which, as you can see, is the exact same table, but I just want to use it to make one quick point. So many people, when they're resistance training, stay in that 8 to 12 repetition range. It's just so important to understand that another benefit of going through this whole 6 to 15 repetition spectrum is that when you train above 12, in that 12 to 15, you're working more on conditioning, which is really important to improve your work capacity and your overall conditioning. But it's also important to go below and at least spend some time below 8 repetitions per set, because that's where you're really going to start optimizing your strength. And so the reason why I bring that up is because, again, so many people just kind of remain in that 8 to 10, or I'm sorry, 8 to 12 repetition spectrum, and they're kind of missing out on optimizing conditioning and optimizing strength. So you kind of need to spend at least some time above it, and you need above 8 to 12, that is, and you need to spend some time below, with that 8 to 12 being just a nice transition period between the two.
In one of the things that we've done throughout, I think, this entire episode as we're wrapping up is sprinkle throughout the how can a rehab professional or even other members in medicine contribute to getting their clients started on a familiarization phase. I'm curious if, from your perspective, Jeff, and particularly on the rehabilitation side, like how would you summarize how, whether it's a PT or another member of the rehab team, how can they contribute to getting their clients started in a familiarization phase? And is that different than what you would identify as like a traditional rehab? Or is it the same? Or yeah, how would you describe it?
Yeah, and after I give my response, I would really love for you to respond too from your PT and clinician perspective, because my answer is that, again, we need to be like, let's say that now you're not a client and you're a physical therapist colleague, and I work with you in the same town, and you're referring patients to me. It's really important from my perspective that you learn this stuff, that you're educated on. So that's really a main part of my answer to this question, is because how are how am I going to benefit, and how are the patients slash clients going to benefit unless you begin this conversation? So, I know through knowing you that it's part of the model where you work at Pinnacle in Seattle, that you get started with conversations on about a long-term plan of care with physical therapy patients very early on, if not like the very first session. So that's another thing that like makes you different. Um, and it really shouldn't be uncommon. It should be the norm in physical therapy. So my answer to you is that I just wish that physical therapists and clinicians in general would take the time to learn this information, speak with their clients, because it's a way to make it easier to move patients through the pathway, because then you can explain to them, yeah, you aren't going to have to worry with Jeff. He's not going to start you with this hard, kill you type of initial training session. He's going to ease you into it with something that actually really closely mirrors what you're doing with us. Or if it's a clinician, say it's a physician assistant or something like that, they can say, so many people have experienced physical therapy that they can say, hey, if you've ever had physical therapy before, the way Jeff's going to start with you is actually this strategic, ease you into the program um, phase.
Yeah, I think the what I would add is it, and I would say this only because I work with a number of physical therapists. The ones that are best at referring to our exercise programs are not always the people that know the most. They tend to be the ones that believe in it the most. They may not have the right language to describe it all the time, but they do some fundamental things right. And it's general advocacy that exercise is important from the start of the plan, right? So the lens of, as a physical therapist, it's not my job to fix you or fix your broken body part. My job is to set you up for as long-term of a solution to improve your physical health as possible. And in the short term, that does mean addressing whatever limitations physically you have. But in the long term, it means, how do we prevent this from happening again? So the people that get it right do that. Now, everything on top of that you're saying is like, it's the other stuff. It's the differentiator between those people. Does someone know? And some of the stuff that, like I said, we sprinkled in earlier, can a physical therapist teach RPE a little bit throughout PT? Are we doing 3 sets of 10 without paying attention? Or are we making sure that by the time someone gets to their 10th rep, they know or have some idea to verbalize how difficult that movement was, how they felt at the end of that, some level of self-recognition of what that movement did to their body and made them feel? And we can start to sprinkle in and introduce some of that stuff. Does the PT plan of care look like a smattering of different exercises every time you come in? Or do we work on fundamental multi-joint movements that are salient to the purpose of PT at that point in time. And this may seem like basic stuff, but it's the best way that we can introduce what this is going to be like, because I can say at the end of PT, hey, I'm going to have you start this program like we talked about at the beginning. It's not going to feel that different from what we did, and instead of
Exactly.
feeling like we're focusing on your shoulder, this is something that will continue to help your shoulder and prevent you from having issues like that in the future. Just think about it being your entire body and doing that on a consistent basis. And so I think it is the knowledge side. It's also the just general belief in this is something that's important, and building it into a process at the beginning of care. Having that lens that, it's not my job to fix you. And, there's a lot of things I can do to help you, but that's not a healthy way for either of us to look at this situation. So,
Yeah.
that's kind of the stuff I'd say.
Yeah. And I'll add one thing, and that is that we think about this differently because we understand that everything should be connected. And so physical therapy, so rehab should just move into post rehab. And so we think about this from a different lens. So therefore it creates a different um, way to go about, everything, the moving patients into the fitness, the programming, the familiarization phase, the ways to start. So it's common sense for us, but when you uh, look at the other side of the coin, and when there's a disconnect, which is just unfortunately the way it is in most situations, then the exact opposite is the converse is true. You don't, PTs aren't thinking about this, and they're going about it, with the variety. They're not thinking about structure. No, they're not thinking about basically setting up the patient for what really should be happening afterwards. And on the fitness trainer side, they're not thinking about this from the sense of, hey, I need to ease them into this and mirror at least a little bit what goes on in physical therapy. So you and I think about this from connecting and merging the two standpoint, and it really again should just be the common thing going on in both PT and fitness, that unfortunately is very uncommon. And so I think that's the reason why this is new information to most people. They just don't think about this connection.
Yeah, sure. Well, maybe that's the difference we can make, Jeff, right?
That's the goal, and that's why again I'm just so excited about these future conversations. So hopefully um, we can add to this sometime in the very near future, actually, where we start to talk a little bit more about. So I gave some insight about familiarization, but I only gave a little overview about periodization. Maybe we can talk about programming and what a little bit more detail about what those phases look like in an upcoming podcast.
That's good. As long as you're willing to take on more of the load in those ones.
Yep, that's fine with me. All
All right.
right.
Sounds
Hey,
good.
Thomas. Yeah, thanks so much for another great conversation, and look forward to the next one. You need assistance in connecting with a fitness professional in your local area or virtually? Add this connection to your patient services? If so, please email mrfinstitute.org@gmail.com. Please also remember to check out mrfinstitute.org for information on how to learn more about the education we offer and to stay current with our podcast series. Thanks for tuning in, and we'll see you in the next episode.